think an interesting topic is just about the hospital and how it's run in general. So, we have a hospital here, and it's like who's paying the electric bill, right? Like how does this place keep the lights on? Okay, so in any hospital there is the C-suite, if you will. So the major administrators that are kind of calling the shots in the hospital. So every hospital that I know of at least has a CEO, a COO, a CFO, a CMO, and a CNO. That's a lot of C's and a lot of other letters, right? So Chief Executive Officer, the visionary for the overall health of the hospital and where it's headed. Any CEO of any organization, they're the top dog. Then the COO is the Chief Operating Officer. So they're dealing with ops from all different angles. And so, especially at our facility, the COO really has a huge responsibility for the operating room itself too. But again, all operations, you name it. If there's a towel dispenser broken somewhere, I'm unfortunately sometimes calling the COO when the other channels below him seem to not be getting it done, right? So it's just like the hierarchy of residency where things should flow upwards. Your CFO is your Chief Financial Officer, so they're making financial decisions for the hospital on the hospital's behalf. Then the more clinical people in the administrative suite are going to be your Chief Medical Officer and your Chief Nursing Officer. And then under all of these different purviews, right, we have different directors. So for myself in the trauma department, so let's just use the trauma department as an example. So we have what we call a TMD, or a trauma medical director. And then below the trauma medical director to help him is the associate trauma medical director, which is what I am. And then each department has something similar, a department chair or a department head or director. And those all report to what we call the MEC, which is the Medical Executive Committee. And then that committee reports to the BOT, which is the Board of Trustees. So the Board of Trustees has the hospital's interests in mind and is there to guide the administrative C-suite. So again, that's kind of how most hospitals work. And then we can go into a full-blown discussion in another talk about then the nursing staff is usually then employed by the hospital, and there's typically unions for nursing. Then all different service lines really kind of depend. So then you have like the anesthesia department. You may have the internal medicine or hospitalist department, interventional radiology, cardiology, and they're all going to have a point person or a chair or a department head or director. But then the interesting question for us as physicians that my students and residents are always asking, it's like, what if you're in maybe private practice or you're hospital employed? So that's like a whole nother talk. But again, just the overall hierarchy of the hospital is how that kind of helps. And maybe some of my hospital administrators or hospital administration is actually a undergraduate, is a degree now, I believe, can chime in to see and help us understand better, how all the cogs and the wheels in this big oiled up machine really truly work.